Hello, Assalamu alaikum. In this video, I would focus on Norma frontalis. So we will. This is big topic. So we will discuss this topic under three headings. Number one is forehead region. Number two is orbit area or orbital margins, and number three is maxilla, and number four is mandible. So when we talk about frontal bone, so if I zoom in bit, so frontal bone actually it is smooth and convex anteriorly, and it this part or what you can see the forehead a part of the frontal bone is the vertical bone of vertical part of the frontal bone, whereas you can see that in the orbit it is forming the roof of the orbit. Just above this roof we have got anterior cranial fossa, and there this frontal bone is forming the its horizontal plate is forming the floor of the anterior cranial fossa. So this is vertical plate, and here comes the you are seeing it, looking at it from inferior view. This is the horizontal plate, and horizontal plate, and here you can see a line in the center. This is metopic suture, and this suture is formed by the union of two frontal bones. It sometimes it may persist in adult life as well. Otherwise it unites and there is no sign of metopic suture. So again, frontal bone, and this is the vertical plate, and this is the horizontal plate of the frontal bone. So in then next is the orbital margin. As you can see that we have just described, this is the orbital margin. These orbits are actually cone shaped structure whose base is forming the orbital margin, and the apex of this cone is directed backwards and medially. So we will discuss this the apex of the orbit when we will discuss about the orbital walls. So in this video as well I would definitely go bit about the orbital walls as well. So this orbital margin is formed superiorly by the frontal bone, as you can see. So orbital margin on the inferior part is formed by the maxilla. Here you can see the maxilla inferior medially this orbital margin is formed by the maxilla, whereas here this orbital margin inferior laterally it is formed by the zygoma or zygomatic bone. So again, orbital margin it is formed by the frontal bone superiorly, and inferior medially it is formed by the maxilla, and inferior laterally it is formed by the zygomatic bone. So as you can see that not even orbital margin, rather floor of the orbit inferiorly and medially it is formed by the maxilla bone. This in this particular animation, the whole of the maxilla bone has been highlighted and turned green, so you could have very good insight of the internal walls of the orbit. And here comes the zygomatic bone. Zygomatic bone, you can see it is forming the lateral wall anteriorly of the orbit, and this or lateral wall posteriorly of the orbit is formed by the saphenite bone, greater wing of the saphenite. So this is the whole saphenite bone. You can see here this saphenite bone, this posteriorly and lateral wall of the orbit is formed by the zygomatic bone. So again you can see this and medial wall of the orbit is formed by the ethmoid bone, in the middle part, whereas superiorly and medially it is formed by the again, you know, this frontal bone. And then we have got this small bone which is called lacrimal bone, and this lacrimal bone is making sutures with this ethmoid bone, and superiorly it is making suture with the frontal bone, and anteriorly it is making suture with the this maxilla. So and with the maxilla. In further, we will discuss about few things about the maxilla. Maxilla has got certain processes. This is frontal process of the maxilla. Why frontal process? Because it is directed upwards, and it is making a suture with the frontal bone, so that's why this process is called frontal process of the maxilla. Whereas here this is the zygomatic process of the maxilla. Why zygomatic process? Because it is making a suture with the zygoma. So here you can see again frontal process of maxilla, zygomatic process of maxilla, and this is alveolar process. Here you can see the alveolar process. Alveolar process, why it is called alveolar process? Because this part of the this part of the maxilla actually has sockets for the teeth of the upper jaw. So again, these two small bones, these are called nasal bones, most commonly fractured during boxing and fights. So look at this the nasal bones. Nasal bone, there are two in number, and these nasal bones, they actually make sutures with each other, and this suture is called internal nasal suture. And these same nasal bones, they form suture with frontal bone again. So these are called frontonasal sutures, and frontonasal sutures. And this point where frontonasal and this frontonasal suture, this point where this internal nasal suture, it actually joins the frontonasal suture. This point is called nasion. And then maxilla, it has got this is nasal cavity, pear shaped or piriform fossa. So this piriform fossa is bounded laterally by the maxilla on either side. Actually, these are two maxillary bones which are united or fused in the middle, and they form the intermaxillary suture, which can be very well seen on the from the inferior aspect of the skull. Here you can see internal maxillary suture. This internal maxillary suture is present in the hard palate. So further we go laterally. Here we see the zygomatic bone. Zygoma comes from the word which means twins. So this zygomatic bones has got certain process as well. This is frontal process of the zygomatic bone, because this forms suture with the frontal bone. So zygomatico-frontal suture. So here again this is the maxillary process of the zygomatic bone. Why? Because it is forming suture with the zygomatic process of the maxilla. So zygomatico-maxillary suture. So posteriorly we have got another process. It is zygomatico-temporal suture, because it is forming a suture with the temporal bone. Here comes the temporal bone as a whole. So in most inferiorly we have got mandible. Mandible literally means Greek word means chewing. So it has got again alveolar process, where and we have got socket for the teeth, and actually these mandible are two in number. They are united in the center, and this is called symphysis manti, and here comes the mental protuberance, and this is ramus of the mandible, and there is an oblique line running laterally and upward from this mental protuberance, which becomes the anterior margin of the ramus. So again, there are certain things which I omitted deliberately, so we could discuss them later on, and those things are very important foramen. This is supraorbital foramen on between the in the supraorbital margin at the junction of the lateral 2/3 and medial 1/3. It gives supraorbital nerves and vessels. Then infraorbital foramen, here you can see on either side, it gives passage to the maxillary division of the trigeminal nerve, which comes out from these foramen as a infraorbital nerves. Then we have got mental foramen, two in number on either side of the mandible. Here you can see posteriorly these foramen leads to alveolar canal, which from which infra mandibular division of the trigeminal nerve along with its vessels pass and comes out at these 2 points as a mental nerves. So this was bit brief about Norma frontalis. uh, I hope I tried my level best to make it clear. Thank you very much.